Great. Mario.
Thank you, Mr. Vice President. We've heard a lot about masks today. We've seen cases rising. Is there any consideration for making masks mandatory or penalizing states that aren't following the CDC guidelines properly?
Well, I think the success that we have had from early in the coronavirus is we have followed the model that we described from early on, which was to have a national response that was federally supported, state managed, and locally executed. Make sure the people on the ground delivering healthcare services, the people most impacted by the disease, had what they need, that states would manage the unique circumstances, and that we would marshal the resources of the federal government and the private economy to support that. And we'll continue to use that model, respecting the decisions that governors are making. There have been states that have delegated authority to local communities with regard to facial coverings, and we support those decisions by governors. But as you can see, there's 12 states that we're watching very carefully now that have both rising cases and rising positivity. There's 4 states where 50% of all the new cases are happening. And so what we want to do is make sure that that the governors, the health officials in those states have the ability to respond in the ways that are most effective there. And that's been a key to our success thus far, making sure as this pandemic has made its way first in the Northwest, then in the Northeast, then New Orleans, Michigan, other parts of the country, we've made sure that the governors and health officials had what they need when they needed it, and we've expressed and continue to express our full support for the measures and decisions that they've made.